Most heart attacks don't begin on the day they happen. They begin 10, sometimes 20 years earlier. And during most of that time, you feel completely normal. No pain, no warning, no obvious sign. So what's actually happening during those silent years? Let's look inside. When people think about heart disease, they imagine a blocked artery, but that's the final chapter. When people think about heart disease, they imagine a blocked artery, but that's the final chapter. The silent phase begins much earlier, inside the artery wall itself. Your arteries are not rigid pipes. Years before symptoms, small injuries begin to occur along that inner lining. Not dramatic injuries, microscopic ones, caused by elevated blood sugar, high blood pressure, smoking, chronic inflammation, even long-term stress. These repeated stresses make the endothelial layer slightly dysfunctional. It stops regulating blood flow properly. It becomes more permeable. And that's when LDL particles, often called bad cholesterol, begin slipping into the artery wall, not floating in the blood, inside the wall. This is the beginning of plaque formation. Your body notices this, and it reacts. White blood cells migrate into the artery wall to clean up the LDL particles. But over time, this turns into a low-grade inflammatory cycle. The immune system keeps responding. More cells arrive, more debris accumulates, and slowly, a fatty streak forms. You still feel nothing. This stage can last a decade or more. As plaque builds, your artery doesn't immediately narrow. This surprises most people. In early disease, the artery actually expands outward, a process called positive remodeling. It compensates. Blood flow remains normal. Stress tests can appear normal. You feel fine walking, exercising, living your life. Meanwhile, the structure of the artery wall is quietly changing. The plaque becomes layered, some stable, some unstable, but still, no symptoms. The real danger is not slow narrowing, it's instability. Over time, certain plaques develop a thin, fibrous cap. Beneath that cap, inflammatory cells and a soft lipid core. From the outside, everything appears normal, but inside the artery wall, vulnerability is increasing. And this is the phase that can last for years, completely silent, until one day, the cap ruptures and the event begins. After age 50, this silent process accelerates because arteries stiffen naturally with age. Inflammation increases, recovery from endothelial injury slows down. The timeline shortens. What once took 20 years might now take 5. And most people don't know where they are on that timeline. Heart disease rarely announces itself early. It develops quietly, biologically, structurally, long before pain, long before symptoms. Understanding this silent phase changes how you think about prevention, because the goal isn't just to avoid a blockage, it's to protect the artery wall years before one ever forms. And that's where longevity truly begins.